So, getting into the assignment. So first of all, what needs to be included? So what are the main important areas that you need to ensure that you have within your assignment? So this is taken from the guide, the assignment guide, which is available on the Canvas site, on your Learning at Griffith site. So the first two here, so 1 and 2, is specifically in the concept map, and number 3 is for the written section. So section 1, so this first part in orange, this is about the risk factors. So this is where you need to essentially list all the risk factors that are in the scenario, and we know how many risk factors do we need to find, or students, how many risk factors do you need to find to include in your concept map for your assignment. So when we say all, yes, that's correct, 3. So just make sure you have the 3 risk factors that are listed explicitly in the case scenario. Okay, so they are explicit. Don't read into things. They will be literally written in words. So, okay, make sure those 3 are in the scenario. Okay, so what you need to do with the risk factors is you need to demonstrate how these risks essentially increase the likelihood of either the etiology or the pathophysiology of the diagnosed disorder. And hopefully by now you know what the patient is diagnosed with. Can you just remind me that you do indeed know what the diagnosis is, students? What is your patient for your assignment diagnosed with? Yes, so it's not so much the bacteria, that's going to be the etiology, it's going to be the meningococcal. So the meningococcal is the diagnosis, the etiology is the Neisseria, okay? So when you look at the risk factors, you need to look how these are a risk towards the meningococcal meningitis diagnosis, okay? And now they could link into directly the etiology, which is the Neisseria, or somewhere in the pathophysiology. And I'll explain this shortly when I go through an example of a concept map. The second part of the concept map is to create a step-by-step pathophysiological sequence. So that will be essentially the main crux of the diagnosis. Okay, so the main important part of the meningococcal disease. Okay, and then once you've created that main stem or that main section of your pathophysiology, then you can bring out all the clinical manifestations. Okay, and again, students, remind me how many, when it says all, how many clinical manifestations should you have in your concept map? Yes, brilliant, 5, that's right. So just make sure you have that clear in your mind that you need to have 3 risk factors and you need to have 5 clinical manifestations. Okay, so when you go to your rubric, what you'll actually find is for this first section, it's marked out of 6, so 6 marks. So what is that telling you in terms of weighting? How many marks per risk factor are you going to receive if you get those, like, you know, the full marks per risk factor? If it's marked out of 6 and there are 3 risk factors, each is worth 2. That's right, Tina. So just bear in mind that in your concept map assignment, the concept map section, the markers are essentially looking 2 marks per risk factor. And then when we go down to the clinical manifestations, the 5 is going to be marked out of 10. So again, that's 2 marks per clinical manifestation. Okay, and so the final thing that's left is the stem or the main crux of the disease pathophysiology, and that's marked out of 3. So this is where you'll be getting your marks in your assignment, at least in the concept map section. 6 marks for the risk factors, 3 marks for the pathophysiology, 10 marks for the clinical manifestations. And then Jackie will talk about 3 here. So what I'm going to do is I'm going to go into section 1 and 2 now. So these two parts I'm going to go through now. And again, if you've got questions, just pop them into the chat. All right, okay. There's just a couple of FAQs, so frequently asked questions from students. We have made a guide here as resources on the Learning at Griffith page. So there's actually a PDF document that has answered the FAQs that students ask or commonly ask. So the first one is that the concept map should be color coded, and just make sure with the colors you have a key that tells the marker what each color correlates to. Okay, and remember the concept map part of your assignment can't be any more than one page. Okay, so it's either going to be one page if you have decide to submit it as a Word document, or one slide if you're going to submit it as a PowerPoint file. But it can't go over one page. Okay, the size, particularly in the concept map section, cannot be smaller than 10. Okay, so that's going to be the smallest you can go down to. Okay, otherwise it's too hard for the markers to read.
Girl. How was your night?
I think so.
Hey, girl.
I think someone's microphone's on. Let me just mute that for a second. Okay, guys, can you still hear me? Okay, good. All right, so that's the font size. In terms of the in-text referencing, you don't need to in-text reference your concept map, but you indeed have to in-text reference the written section. So the 500-word section has to have the citations within it. The risk factors and clinical manifestations, as I mentioned just a second ago, they have to come directly from the scenario. So they're not coming from the literature. You'll be informed by the literature, but they have to come from the scenario. Okay. Many students ask around the written section, are you allowed to have headings? Yes, you can use the headings if it makes it easier for you. You don't have to have them, but you can use headings. So that could be a heading for diagnostics and a heading for treatments, but you don't have to have them, but some students prefer to have them in there. In terms of the dates of the references that you use, we encourage to be within the 10 years. Okay, so just make sure that's from 2013 onwards. As I said, the written section needs to be adequately referenced, so both cited and those citations need to be found within your reference list, and definitely make sure that you adhere to APA 7. Okay, and then finally, just ensure that your submission time is on time. Even a minute late will incur a late penalty. So just be mindful of that. Don't try to be submitting your assignment in the last couple of minutes. Really, you shouldn't be submitting in the last hour, but definitely don't leave it to the last second, because invariably what happens is there's IT issues or something will happen, and then it will result in coming in a bit late, and then you'll incur a penalty. So that's the FAQs. What I'll do now is we'll go to the concept map section specifically, and this is just my suggestion on how you should approach, or just suggestions on how you should approach this section of your assignment. So this particular one, I think this was in 2021. So this was an assignment topic in 2021. So here we've got Steve. Down here, he's been diagnosed with COVID, and the infection being, or the etiology being, the SARS-CoV-2. And you can see that here, I've put it in down here under the etiology. So within this case scenario, what you're wanting to do is extract out the risk factors, which we know that there's 3, and the clinical manifestations, what we know there's 5. So in terms of this particular one, the risk factors are obesity, male, and the age. So it's an older age, that's a risk. Males are a greater risk than females, and obesity is also a risk. In terms of clinical manifestations, the clinical manifestations in this scenario is fever or fever, the loss of taste, the drop in oxygen saturations, urine output, so oliguria, and inspiratory crackles. So that's the 5 for clinical manifestations, and that's the 3 risk factors. Okay, so what we can do now is we can go and start looking at how we can create our map now that we know what information we need to put into it. So the first thing that I recommend you do is create the pathophysiological central section. So this is the central part of the disease. So one of the first things you would have on your map is the etiology. And we know the etiology is the virus for COVID, okay? So you need to think about, well, what does the virus do now to take hold and start to become disease causing? So the virus comes in and overcomes the immune system. And then what this particular virus does is it binds to a certain type of receptor in our upper respiratory tract called the ACE2 receptor. So that obviously is something that you need to find in the literature. That's not something that you necessarily would know at the top of your mind. So that would be informed by going off and searching the literature. So the virus binds to this receptor, most likely in the nose and mouth, and that then essentially takes hold of those cells. So the virus, being an RNA virus, will inject its genetic material into your cells and get the cells to start replicating new viruses. And essentially that will start to lead to the host cell being destroyed. And this will continue to take place as it moves down the respiratory tract. So we just see this kind of invasion of cells moving from our nose, mouth, down into the pharynx, and then further down if it's going to take hold in a person in a more serious way. So this is probably a good starting point of how, for most people with SARS-CoV-2, this is what's going to happen to pretty much all of us if we do get infected. Then we can probably start to think about how we can bring the risk factors in. So the first one that I've listed here is a male. Okay, so males do have a higher risk that's related to COVID than in comparison to females. And again, you'd have to go off into the literature to figure out what's the mechanism behind that. So why is being a male at a higher risk related to COVID in some way? So what I found was males do actually have a slower immune response initially than females. So then what that would result in is an increased likelihood of the virus to invade the immune system, and then that would essentially come in to the virus overcoming the immune system. And what I haven't done here, but essentially what you would have is arrows linking them. So you'd have an arrow going in that direction, and then probably coming into here like so. And same coming down this way, because this is the direction, this is the sequence that these events occur. Okay, does this all make sense so far, guys? Okay, now the other thing that, so the other thing that I've found that males have a greater risk in comparison to females is that they have a greater number of ACE2 receptors. So they express more ACE2 receptors, which then would basically mean if you've got more receptors for the virus to bind to, it's more likely to attach itself. So again, we could see the arrows coming in this direction and then coming into the central pathophysiology that we created before. So this is the kind of the central process of how the virus takes hold. And what we're showing here is the pathophysiology of the risk factor. So this is the mechanisms of how the risk factors come into the central part of the pathophysiology. Now, with a lot of diseases, what you'll find, the risk factors actually increase the likelihood of, around the etiology, around the cause. But there was some risks that I've put into this case where they weren't a risk for getting the virus. It was more about the risk of getting a more serious disease of COVID. Okay, and the first one is obesity. So generally people who are obese have a poor immune function. And so by having specifically, a poor respiratory immune function. So we did this in one of the tutorials this trimester where we saw that your respiratory tract have a whole lot of innate immune functions to prevent us being infected by viruses or bacteria, etc. So we have certain innate things, in whether it's a physical, whether it's chemical, or whether it has certain cellular responses to try to counter being invaded by the invaded by microorganisms. Because believe it or not, more of our lung field is exposed to the outside world than skin. So there's more of us in terms of lung that's exposed to, let's say, the room than our skin. So if we were to roll our skin out, it would only be about the size of 2 meters in surface area. But if we were to roll out our respiratory tract, it would probably be the size of a squash court. So it's a significant amount of surface area exposed to the outside world. And that means there's a lot of potential for our lungs or our respiratory tract to be invaded by the microorganisms. So we need to have a good innate immune system to prevent us being infected. And so obesity actually increases or decreases that immune response. Therefore, in the case of COVID, that poor respiratory immune function means that the virus can take hold more seriously. And therefore, you're not more likely to get the virus, but you're more likely to get a serious dose of the virus. And the other thing is an old age. And just make sure in your assignment, if you find that age is a risk, you need to tell us what about the age. Is it an older age? Is it a younger age? And probably be good to tell us specifically what that age is. So maybe say here, greater than 50. Okay, so just make sure you specify that. Just don't say age, because you won't get full marks, because that doesn't tell us what about the age. So you need to tell if it's a young age or older age, okay? And with an older age person, and we probably all know this from living through the pandemic, we've heard that older people are a greater risk of getting really sick and potentially dying. And part of the reason for that is that they have a greater inflammatory response. So their immune system in some ways overreacts to the virus and being infected by the virus. And therefore, when the body overreacts, it's more likely to become harmful to the body. Okay, and so what that ends up in becoming is a viral type of pneumonia. Okay, so what we've done here is we've listed the 3 risk factors and we've created a mechanism for why they are risks. And if you do this, and we can see that you've understood the mechanism behind the risk factors, you're then going to, get the full marks. It's only when you don't produce an adequate mechanism is where you get, poorer marks in this area. So for an example would be if they just had male and then it just went straight to the immune system, you would get you would get some marks for just listing the male, like half marks, but you wouldn't get pretty much no marks because you haven't told us what the mechanism behind that is. Okay, so just ensure that you have some steps to tell the marker why that particular risk factor is indeed a risk. Okay, so that's the risk factors. Does that all make sense so far? Any questions? Okay, so I'll move on to the clinical manifestations. So one of the first clinical manifestations that I just put in was the inspiratory crackles. Can you tell me what that actually means? What does it mean to have inspiratory crackles? Have you heard of this term before? I'm sure you've heard inspiratory. You would have heard that term in A&P. But what does crackles mean? Yes, it's a sound. It's a lung sound on inspiration. That's right. Fluid, yep. So crackling is basically like the alveoli, so that right at the bottom of your respiratory tract are popping open on inspiration. So there's fluid in there, and on expiration, so breathing out, they kind of close in, collapse in, and then when you breathe in, they pop open, and then it sounds like crackling. Okay, so that's inspiratory crackles. So what we have to develop here is how would, let's say, viral pneumonia lead to crackles? Can anyone think of what a process could be on how you could go from a pneumonia state to having the sound of crackling if you were to listen to the person's chest? Now remember, pneumonia is essentially just a word that means inflammation. So it's an inflammation. Pneum is lung. So it's just essentially inflammation of the parenchyma. Parenchyma is just the functional part of your lungs. So your lung and all your lung kind of fields, depending on how severe that pneumonia is being inflamed. And we know that with inflammation, we get a exudate or we get swelling. And so this is like the local inflammation, but of lung tissue. Okay, so we have to come up with a mechanism of why a person would get crackling on their lung by a pneumonia. So you could come up with maybe another step here, but you got viral pneumonia, which leads to an increase in vascular permeability within the lungs, which then leads to pulmonary edema. That just basically means edema is just fluid. So pulmonary lungs, so just fluid within your lung tissues. That fluid will accumulate, particularly down at the bottom section of your lungs, which are known as the alveoli. And then that, when listened to by a stethoscope, would be the inspiratory crackles. So that, again, you would have arrows connecting each one of these, which would tell us this is the direction that it's going in. Okay, so we have the pneumonia, increase in vascular permeability, leading to pulmonary edema, fluid accumulates in the alveoli. You might have another step there that talks about airways close on expiration and then pop open on inspiration, and then that's heard in as a clinical manifestation of inspiratory crackles. Okay, so that's the first one down. The next one would be hypoxemia, which essentially just means low oxygen in blood. So what do you think's happening there, guys? What do you think? Why do you think a person would become hypoxic, or hypoxic specifically in their blood, with a pneumonia state? And remember, we did this in, I think, the 4th tutorial, okay, with the gentleman, that might be the 3rd one, the gentleman, I think it was Mr. F, in the aged care facility, and his was bacterial pneumonia, okay, and he developed that as well. So the pneumonia being inflammation, putting fluid into the gas exchange area. So that then would mean there's no, so you could actually pull an arrow off this that would decrease the gas exchange ability. So there's less capacity for oxygen to cross over into the blood because your airways are filling with fluid. So it can't get across that fluid and get into the blood. And therefore, lower oxygen in the blood is going to result in hypoxemia. Okay. The last one I'll finish on, so I'm not going to go through all of them, but the last one I'll finish on is oliguria. So this one is a bit more challenging. Can anyone think on how COVID, or this process that we've created already, could lead to a person having a low urine output? Any thoughts, guys? How could that be possible? How could a respiratory infection lead to a person having poor urine output? I'll just give you 20 seconds, 30 seconds just to think about it. Yes, and there's some good suggestions there. So we've got obstruction. So I guess possibly we know that COVID causes clotting. So I guess there's a possibility that the kidneys could be obstructed by clots, which would then decrease their blood flow. That would probably lead into, as Chrisello said, kidney injury, acute kidney injury, if they're not getting a good blood flow, and that would, essentially kill off your kidneys if you're going to have complete obstruction. So your kidneys won't survive very long without blood flow. But as Danielle said, there's a fluid shift. Okay, so the fluids for some reason remain centrally, or dehydration, and therefore impacting the blood volume, and then therefore blood pressure, etc. So that's pretty much along the lines that I was looking for. So I'll put the process in. So we have release of pro-inflammatory chemicals. We know that, well, you guys know that now. So what kind of chemicals are released when we have inflammation? Can you give me some examples? So when we have inflammation, just generally, don't be concerned at this point just by lung inflammation. Let's just think inflammation in general. Yep, Chrisello, very good. Cytokines. So we have cytokines released. So we have inflammation, which releases pro-inflammatory chemicals, which would then lead to, high amounts of cytokines. Cytokines would then lead to, sorry, I've jumped a few steps now, would lead to cytokines entering the bloodstream, which we now have systemic inflammation. So this means whole body-wide inflammation. We can see that if you take these cytokines to the hypothalamus, that will essentially lead to a fever, and that's part of the reason why you develop a fever with certain infections or inflammatory states. The cytokines that impact the hypothalamus will cause the fever. But if you keep going down this path, if you have inflammation systemically, that's going to increase the permeability of all your blood vessels, which then essentially in conjunction with vasodilation. So that's going to be similar to what we see in anaphylaxis, where we get huge amounts of fluid shifts out of the blood vessels. So we have dilation and fluid shifts out of the main central vascular system and going into the tissue, which leads to essentially a septic shock state. That's going to result in a drop in blood volume, therefore blood pressure. Okay, and therefore, if you haven't got a good pressure, your kidneys basically need, at their level, about 60 millimeters of mercury pressure to generate glomerular filtration. So if you haven't got a blood pressure, you're not going to have kidney perfusion. Therefore, you're not going to have a glomerular filtration rate, which then means you're not going to make any urine. And as a result, you see little to no urine coming out of the patient. And this is going to be a very good sign to keep on top of with a lot of your patients who are deteriorating is that their urine output is going to start drop. And so that's a fairly good indicator of deterioration in your patients. Okay, so that's essentially the concept map for COVID, at least for the case that we saw. Hopefully that has kind of given you an idea of how to approach the map, what to include, how to, you know, do section by section in conjunction with your literature searching, and how to construct and what we expect as markers